Hello, this is just a quick overview of femoral acetabular impingement, also known as FAI. So what is FAI? So it's a hip condition and it's characterized by abnormal contact between the femoral head, so the ball, and the acetabulum, the socket of the hip joint. This interaction can lead to pain, restricted mobility, and potentially contribute to the development of hip osteoarthritis over time. FAI typically affects young and active individuals, particularly athletes involved in sports requiring repetitive hip movement. So there are actually three primary types of FAI, and each of these involve different mechanisms of impingement. So we have CAM, we have mixed, and we have pincer. So just looking at CAM and pincer, just a brief overview. So CAM impingements are normally, there's a high prevalence in males. And 1 in 4 of the general population will have a CAM impingement. 50% of these when hip internal rotation is limited as well. And pincers are actually more prevalent in females. So let's have a look at CAM impingement in a little bit more detail. So this occurs when the femoral head is not kind of a perfect fit within the acetabulum. And this leads to a non-uniform contact with the acetabulum during hip movements. CAM impingement is common among young male athletes involved in activities that require a lot of hip flexion and rotation. So pincer impingement arises when there's excess coverage of the acetabulum. And this can cause the labrum, so the ring of cartilage in the joint, to be pinched between the femoral head and the acetabulum. And this can result from a deep or overhanging acetabulum. And then we have mixed impingement. And this involves a combination of both CAM and pincer impingement and kind of compounds their effects. So how do we know if someone's got an FAI if they come into clinic? So the signs and symptoms of an FAI include groin pain or discomfort, hip pain during certain movements, such as deep flexion or rotation, stiffness and limited range of motion, and a sensation of catching or locking in the hip. When you're diagnosing FAI, normally you have to have a comprehensive assessment, including medical history, a physical examination, and we can use imaging tools such as X-rays and MRIs. And these tests can help identify the type and the severity of impingement, and this can all contribute to an accurate diagnosis. So how do we treat an FAI? The management of an FAI typically involves a combination of non-surgical and surgical approaches. And this all depends on the severity of the condition and the patient's goals. As therapists, we would always try and do conservative treatment. And this is therapy to improve hip mobility, strengthen surrounding muscles, and modify activities to reduce impingement risk. Medical doctors may work with pain management through non-steroid anti-inflammatory drugs or other pain relievers, or they could go in and inject to reduce pain and inflammation. You can also do surgical interventions. So for cases that are not responsive to conservative treatments, so we would always do that first. Surgical options may be considered to reshape the hip joint and repair the damaged tissue. Prevention of FAI, these are things that we need to keep in our mind when we're treating somebody with this condition. Now, while FAI can be influenced by anatomical factors that are not preventable, athletes can take steps to reduce their risk. So they can engage in proper warm-ups and cool downs, employing correct techniques during sport and exercise, and maintaining balanced hip flexibility and strength. FAI underscores the importance of early detection and tailored management to reduce the symptoms, to enhance hip flexion, and to support a higher quality of life, particularly for those individuals who are leading an active lifestyle. Thank you for listening.